EMDR, which stands for Eye Movement Desensitization and Reprocessing, is a therapy technique used to help process traumatic events or other life stressors and replace them with positive beliefs. It is a tool Lexi Erickson has used to work through both some larger experiences as well as some smaller experiences of her own.
I had been doing talk therapy and wasn't really having the success that I wanted. And so Amber had been recommended to me, and in person, she explained what EMDR was and kind of everything, how it works.
She meets weekly with Amber Lehman Myers, who is an outpatient therapist at the Avera Behavioral Health Clinic. So, what does a typical session look like?
We work on the coping skills. We build a target sequence, which kind of outlines what exactly we want to be addressing with EMDR. And we also look at what is an adaptive statement and a maladaptive statement.
You begin with a negative belief, and you end up, or you choose kind of an opposite positive belief. So if the belief is I'm not good enough, your opposite belief might be I am good enough or I'm okay. You're ultimately working towards that positive belief to kind of rewrite your negative feelings.
Next, the session involves working on bilateral stimulation, which can involve tapping on your legs or arms or even working on eye movements.
You are looking back and forth, you're following her fingers as they wave in front of your eyes, or it might consist of bilateral tapping on your body, whether it's your shoulders, your knees, your arms. And the idea of it is to stimulate both sides of your brain.
Being able to do the tapping or the leg movements keeps them from that stuck position to being able to move forward and hopefully get unstuck to help their brain be re-engaged and to live the life they want to live.
By doing this, it helps a patient take a negative past experience and update it to an adaptive present perspective.
The goal is ultimately to get some of that desensitization, get towards a positive belief.
Erickson says EMDR has been helpful for her and encourages others to find an option that works best for them.
I feel really lucky that it's been something that's worked for me, but there are a number of different types of therapy, and I think the biggest goal is to find one that works for you.
Some people I've only done 2 or 3 sessions and just their face just radiates peace. It's an incredible experience. Other people, it's taken longer. It's taken a few years, and so it just really depends on the situation and what we're addressing.